The slick, wintry weather is here, increasing your chances for a fall. BNEWS spoke with the chair, Emergency Medicine, Lahey Hospital and Medical Center.
When outside in the winter, you want to make sure that surfaces are treated. So if there's a chance that surfaces are slippery, you want to make sure that they have sand or de-icer or salt, just to make sure that any ice that is there has been taken care of. You want to make sure if you need assistance, always ask for it, whether it be ambulatory assistance with a cane or a walker. If there's a handrail, make sure that you can reach it and you definitely use it, or even another person. Ice, snow, slush, surfaces that don't even appear slippery at first can be dangerous. And so don't ever take anything for granted. Even if a particular surface doesn't look like it's obviously icy, always test it out. Be cautious before getting onto a new surface. The ice there can be deceptive. In the home, it's crucial, and there's a lot of things that you have control over. So, number one, make sure that your environment is clutter-free. That's the most important thing. Make sure that loose rugs are adhered to the ground and fixed as much as possible. You want to eliminate as much as possible cords and other low-hanging, ankle-level type of trip hazards. Be cautious of pets. Make sure that they're not running around your feet. They're tangling your feet with leashes and other things of that nature, and make sure that any spills are immediately picked up. Wet surfaces, of course, particularly on finished hardwood floors, are deceptively slippery and can lend people to fall. So unfortunately, falls can both cause minor injury and major injury. And so we see a wide array of traumatic injuries from falls that include minor closed head injuries, major closed head injuries, lacerations of the face, scalp, and extremities. We also see a variety of different long bone fractures, including forearm fractures, hip fractures, shoulder injuries, and dislocations. Not everyone who hits their head needs to come to the hospital, and not everyone who hits their head needs to call for an ambulance. However, there are certain things that if these happen, or you're on certain medications, you'll definitely want to call an ambulance to bring you to the hospital. So number one, if you fall and hit your head hard enough that you lose consciousness or you don't remember the event, that's a reason why you'd want to get checked out. If you are on blood thinning medicines, very common medications that thin your blood to prevent clots can also lend themselves to bleeding. So hitting your head on a hard surface on a blood thinning medication often means you should go to the hospital to get checked out. If you have severe headache, if you feel confused, or you've been vomiting at home, all of those are generally accepted triggers to bring yourself to a hospital for an evaluation.